this test is a diaphragmatic breathing test. And so when we do this test, I'm going to do some things. I don't want to cue my patient as I go through and I'm doing this test. If I'm cueing my patient, I'm actually maybe impacting the result of that test. So what I'll do here is I'll ask my patient to please place one hand on his chest and then one on his stomach, and then I'm going to say, can you just please relax for me? And what I'm doing here is I'm looking to see, as my patient breathes, how are they breathing? So what we're looking for here is abdominal breathing, meaning that the patient is breathing by utilizing their diaphragm rather than using their chest to initiate that breathing process. If I have a patient that is using chest breathing as a primary mode of ventilation, of breathing, that indicates to me that we're not utilizing that diaphragm as effectively as we could. And then we can use that as we're exploring whether or not this patient has a lower cross syndrome or something similar, because that diaphragm is necessary for the stabilization of the core. One way that I like to think about this is if you have like a can of soda. The top of that can of soda is the diaphragm, the bottom is the pelvic floor, and then all around it is all the stabilizing muscles. So on the front of that can is all of your abdominal muscles, and on the back of that can is all your lumbar muscles. If I take that can of soda and I open it, if I pop the tab on it, that's like me not utilizing my diaphragm to stabilize. And so what happens then is if I squeeze that can, all the soda comes out. But if I adequately stabilize with my diaphragm and I squeeze that can, meaning that it's not open anymore, then that can doesn't crush, that canister, that core is strong and stable. So that's why we use this test to help assess whether or not we have adequate diaphragm function.